Hello, welcome to New Start at Home. I'm your host, Don McIntosh. We're glad you're with us. And we're delighted today to have in the studio Dr. Neil Nedley. Welcome, Dr. Nedley.
Thank you. It's good to be here.
And, we see a lot of you around these parts, which is good. We have patients that go through the NEWSTART program, and many of them will ask, is there anything about this program that could help someone that wants to avoid or maybe even has that dreaded word cancer? And what would you say to someone like that?
Well, absolutely. Cancer can be prevented through NEWSTART principles very clearly. In fact, Harvard University and others say about 80% of cancer could actually be prevented if people consistently lived the lifestyle that is espoused here at Weimar, the NEWSTART lifestyle.
And the unfortunate thing is many people don't even know about Weimar until they haven't lived those principles, and maybe they have a very troubling diagnosis. So what are some principles that you could give hope?
Well, fortunately, there are some lifestyle principles that can help actually treat cancer as well. In fact, these studies are being done at major cancer centers throughout the country. One study at MD Anderson in Houston showed that when you take breast cancer patients, aggressive breast cancer, 95% of the time the breast cancer will go and spread to the lungs, which is obviously a fatal condition once that happens. If they're given chemotherapy, Taxol, which actually comes from a tree bark, but it is a potent chemotherapy drug that also can kill some good cells off. But when someone's got the diagnosis of cancer, if those cells aren't destroyed, that's right, that patient's going to be destroyed from cancer. So we have to take aggressive measures. Taxol will actually, when it's given, 75% of patients given Taxol will have that breast cancer spread to the lungs.
So it goes from 95% down to 75%, so it's only like 20% of the people are benefiting.
Helps 20% of the people, which is worth it in most cases.
Yeah.
But when you combine Taxol with turmeric, which is an herb,
that yellow substance.
That yellow substance has anti-cancer properties, 22% of that group will have cancer spread to the lungs.
Wow.
So Taxol combined with turmeric produces the best results. And what we're finding out is when someone has cancer, to go through aggressive measures plus using lifestyle measures that have been proven to benefit will greatly enhance their chance of survival.
You know, here at the NEWSTART program, we have like scrambled tofu, which is an egg substitute or whatnot. Very good for you, but we sometimes color it with turmeric, and we know how to cook with turmeric, so you learn a lot of those principles here. Any other principles you want to share?
Well, a recent study was done at the University of Rochester, New York on pancreatic cancer. That's another deadly cancer, and radiation doesn't help very often. It can help in very few cases. But what they found out is when we combine radiation with resveratrol, which is a bioflavonoid that's found in a lot of fruits in particular. Resveratrol plus radiation produces far better results. And red grapes have resveratrol, peanuts are a good source of resveratrol, and so are red raspberries, a good source of resveratrol.
So in other words, what you're saying is that certainly when you have that diagnosis of cancer, you need to look at medical options, but don't forget the lifestyle options. They can really potentiate and improve your odds.
Exactly. And that's why here at Weimar, our long-term goal is to actually not only be able to come here for cancer lifestyle treatments, but also for a complete cancer treatments, where while you're getting your radiation, you're actually getting your resveratrol at the same time. And so we would like to, unfortunately, even at these university studies, not all the oncologists use resveratrol. It's only one little group that's doing that particular study. We'd like to put everything in place that can potentially help the patient all at once. And you could even get that at NEWSTART now. You might have to go down to Auburn to get your radiation, but at least that's only a few minutes of treatment per day. You can come back to Weimar and then get the NEWSTART cancer treatment.
And I think that what I really like about what you're saying is that so many times when you have this diagnosis, you hear about what everybody else can do, but this helps you know what you can do as well.
Exactly.
Thank you so much for joining us for NEWSTART at Home. We hope that as a result of today's program, you have some principles that can maybe help you or someone you know. If you want more information, go to the website newstart.com, and we hope to hear from you and be a help to you in the future. you.